Hi, I'm Annelise Appleseth, and I'm doing a presentation on recurrent exertional rhamdomyolis. Who does it affect? Well, it usually affects thoroughbred racehorses with an autosomal recessive gene. This is usually only found in thoroughbred racing horses because it's passed on from the mother and the father. Signs and symptoms are similar to tying up. So you're going to see pain and stiffness in the lower back, gluteals, and muscle regions. You're going to see shorter strides and even immobility when it has progressed far enough. You're going to see sweating because it's incredibly painful. And the hard hind muscles are still going along with the stiffness in the lower back. You're also going to see an elevated respiratory rate. It almost presents like colic in a horse, but you add the immobility of the horse and the unwillingness to go forward, which is what is kind of distinguishing it when it's presenting. The diagnosis can be really confused with tying up. It has very, very similar symptoms. It has very similar treatments. However, in thoroughbreds, the difference is that RER, or recurrent exertional rhamdomyolis, is an autosomal recessive disease. So if you look at this chart here, the father can be a carrier, and because it's recessive, he won't show the trait, and the mother would be a carrier too, and she won't show the trait. So you've got 1 out of 4 children that would be effective. There'd be 2 carriers, 1 non-effective carrier, and an affected carrier of the gene. Another part of the diagnosis is that you have to base it upon the exertional RER happening. So you can't just say that the horse is affected when he doesn't show any signs. Another thing that they can do is they can test elevations in serum, myoglobin, creatinine kinase, lactase dehydrogenase, and aspartase aminotransferase. These are levels in the body that would show up after an episode occurred. So why does it happen? Besides the autosomal recessive trait, it happens because of a trigger. You can have low electrolyte concentrations or even too high electrolytes concentrations during intense exercise. So this kind of throws the horse off and they can't deal with an overload, or they have the opposite problem where they don't have enough electrolytes in their muscles. Another problem is people feeding high-grain diets, which is what we have to do with a lot of the thoroughbreds in the racing industry because we want to get as many calories into them as possible. But the problem is that the high-grain diets that some people feed have a lot of carbohydrates in them, so we have to watch out for that. Here are 2 stained cells. You've got the RER affected on the left and the normal horse on the right. The RER nucleus, the nuclei are towards the center of the mature muscle fibers rather than underneath the cell membranes as seen in the normal healthy muscle cells. So the nucleuses are those dark spots on the cells, so you can see the difference between the normal horse and then the RER affected horse. So there really is no treatment for this disease. It's more of a management, besides the fact that you don't want to breed 2 carriers of the disease. So management is when it initially happens, the goal is to relieve anxiety and muscle pain, correct the fluid balance, acid-base deficiency, and prevent renal compromise. So when it's happening, you have issues in the metabolitic pathways in the cells, so you're trying to slow this down. So acetopromazine relieves the anxiety. It also might increase blood flow to the muscles, and methocarbamol is used as a muscle relaxant because the horse's muscles are so tense, just like as you would see in tying up. Another thing you want to do is rest with hand walking. You don't want to leave a horse in stall rest and not have them move. You're setting yourself up for problems there. You want to be able to minimize the amount of exercise the horse is getting, but make sure that the horse is still getting up and getting blood flow and getting some movement. The other one of the biggest management pieces is changing the diet. So when you're to feed the RER horse, you're going to change the diet to a high-fat diet and low-carbohydrate diet. You need to have the diet be 20 to 25% of the total calories as fat. That's 2 to 3 times higher than the normal horse would have in their diet. So it's kind of hard to find. You don't find it in a normal ration balance, but we need to find it for these RER horses. So instead of higher carbohydrate diets like sweet feed or corn, we're going to lower that, feed them more alfalfa and legumes, and then we're going to supplement fat sources like rice bran, corn oil mixed with alfalfa pellets, or sprayed dried fats. So again, getting that high fat diet, low carbohydrate diet. Sugars and starches should also be less than 15% of the total daily calories. And you want to add a high protein into their new ration to build muscle. Here's my Works Cited, and thank you very much for listening.